Greetings from IMA CGP. In this video, we are going to see about the current indications of adenotonsillectomy, which is a very common procedure done by ENT surgeon. A lot of pediatric patients can present to you with problems which will need adenotonsillectomy. So it is very important for you as a family practitioner to be aware of the proper indications for this surgery. I am Dr. Shaktesh, Director, Nose Nose Clinic and Hopkins ENT, Chennai Tambram. See, before we go into the indication of adenotonsillectomy, we should have a basic knowledge about what this adenoids and tonsil are. These are part of what is called as a Walde's ring, which are part of what we call as MALT, that is mucosa associated lymphoid tissues. These are various lymphoid tissues located in our upper aerodigestive tract, which are supposed to play role in mucosal immunity in kids less than 2 years. That is, breastfeeding kids, they have active function wherein they play a role in mucosal immunity. So these tissues include the adenoids, which is located in the nasopharynx, the tonsils, or the pharyngeal tonsils to be specific, which are located in the oropharynx, then the lingual tonsil, which is located on the back side of the posterior part of the tongue, and you also have the tubal tonsil, which are located on the eustachian tube projection. So these are the various lymphoid tissues in our upper airway. So there can be various problems which can develop in these tissues, particularly once they lose their function. After 2 to 3 years of age, they don't play any major role in the immune function as per various studies which have been conducted, because many a times we see even among doctors there is a belief that these tissues play a role in immunity, but that's not true in kids above 3 years of age. So that is a very important information to keep in mind. So various problems can happen in these tissues, requiring surgery for removal of this tissue. So currently the major indications of an adenotonsillectomy surgeries include obstructive sleep apnea, recurrent infections of the tonsillar adenoids, peritonsillar abscess, dysphagia and dysphonia, and finally other indications for this surgery. So we'll see about these indications one by one. So obstructive sleep apnea or sleep related breathing disorder is the most common, and it is in fact the only absolute indication of adenotonsillectomy procedure nowadays, because a child with chronic mouth breathing and snoring is considered a high risk child, because it can result in a lot of problems which can happen over a period of time. Why it has to be given utmost importance and not to be ignored? Because many a times we see both parents and at the primary healthcare level, this chronic mouth breathing is not given much importance. It is often written off like a common cold or URTI, but it is not to be done, because any mouth breathing child should not be ignored, because if a child is left to mouth breathe on a long term basis, it can result in lot of long term and most of the time irreversible consequences. When a child mouth breathes, what happens is, because it's a growing skeleton, there can be a lot of skeletal changes which will facilitate mouth breathing. Basically, the child's skeleton will grow in this format and not in the anteroposterior format. So that will result in various problems like a high arched palate and crowding of teeth, and commonly that is referred to as adenoid facies. And these kids, when they grow into adults, they can, because of the altered craniofacial anatomy, they are predisposed to develop an adult type obstructive sleep apnea syndrome. So a chronic mouth breathing is the most common indication for adenotonsillectomy today, and it has to be given utmost importance and not to be ignored. So that is the most common and the absolute indication for adenotonsillectomy. Next indication for this surgery will be recurrent infections involving the adenoids and tonsil. According to the American Association of Head and Neck Surgery, any child who has more than 5 episodes of proven tonsil infection in 1 year is considered an indication of for removal of the adenoids and tonsil. And then if a child has more than 3 episodes in 2 consecutive years, that is taken as an indication. And if the child is having a chronic problem like more than 3 years, if he is having 2 or more infection, over 3 consecutive years, it is considered an indication for removal of adenoid and tonsil. But when it comes to adults, the indications are different. Even if an adult has only one episode of proven tonsil infection in 1 year, which happens regularly, that is considered as an indication for adenotonsillectomy. And then you have peritonsillar abscess or quinsy, as it is commonly referred to. Quinsy or an peritonsillar abscess, as the name suggests, is the inflammation of the peritonsillar area which results in an abscess formation. If a child has more than 2 episodes of peritonsillar abscess, that is considered an indication for adenotonsillectomy irrespective of the frequency of infection. And in an adult, if the adult has had more than 1 episode of peritonsillar abscess, it is considered an indication for adenotonsillectomy irrespective of the frequency of the condition. And then finally, in certain kids who have huge tonsillar hypertrophy, they may be having problems with swallowing and speech. And for that indication, even if they don't have frequent infections, we may have to remove the tonsil and adenoids, but that's a very rare indication. And other indications include for biopsy purpose in case of suspected tumors, because tonsil can be the site of squamous cell carcinomas and lymphoma in different age groups. So for diagnostic purposes, we may be doing tonsillectomy as part of diagnostic workup. And in proven malignancies, we may be doing radical tonsillectomy. That is, we are not just removing the tonsil, we are also removing the adjacent muscles as well, and that procedure is called as radical tonsillectomy. And sometimes tonsillectomy can be done as a treatment for chronic halitosis or foul smell from the mouth. And finally, in certain pediatric patients who have dental malocclusions, which is usually caused because of adenoid hypertrophy and tonsillar hypertrophy, for that indication we may have to do adenotonsillectomy for treating the dental malocclusion. After the procedure, the dentist actually will be able to correct the malocclusion. So these are the various indications. To finally sum up, adenotonsillectomy, the most important indication nowadays is the chronic mouth breathing child, which should not be ignored. So that is the most important indication. Thank you very much.